Next is the juvenile spondyloarthritis. Now, juvenile spondyloarthritis is the one where we have asymmetrical distribution of the arthritis that is not distributed symmetrically. We have enthesitis without any extra articular features, that there is some inflammation of the entheses sites but without any extra articular features, that there is no tendinitis, there is no synovitis, or there is no rash around or swelling of the joint. Then we have mostly predominantly lower extremities or lower limb oligoarthritis. Now, with oligoarthritis, we mean that only few of the synovial joints are involved. All joints are not. And it is usually found in the lower limbs, not the upper limbs. And it is usually a characteristic of juvenile spondyloarthritis. Next, talk about the epidemiology. Now, epidemiologically, juvenile spondyloarthritis is found between the age of 7 to 16 years. It is predominantly found in boys. About 60 to 80% of all patients are males, and it has a strong association with the SEA syndrome, that is the seronegative enthesopathy and arthropathy syndrome. Now, because the 80% of all patients with C syndrome also have juvenile onset spondyloarthritis.